Change in Urban Health webinar that's also co-sponsored by SALURBAL. And this afternoon, we're very fortunate to have with us Horacio Riojas, who I'll introduce in a minute. Horacio will be speaking in Spanish. So if you're listening in English, you need to turn on your English translation. And when we take questions, we can take questions in English or Spanish and translate as well. Dr. Riojas is a physician and epidemiologist and environmental scientist at the Instituto Nacional de Salud Pública in Mexico. He has very extensive training in environmental health and epidemiology, population health and medicine. And he has really been a leader in studying and developing recommendations for policy also on environmental health effects in general for a long, long time, including climate. Even before it became more common for us to all focus on climate, Horacio and his team were already talking about climate many, many years ago. And I became even more aware of the depth and the breadth of the program that Horacio leads during a visit I made to the Instituto Nacional de Salud Pública just last week, where I was able to meet with Horacio and his team, and I was really, really impressed by the breadth of the work that they do, not only in scientific research and generating novel findings, but also in thinking about how that translates to real policies, and also in working with partnerships and policymakers and communities. So it's a really, I think, exemplary research group and that Horacio has been leading for many years. And so we're very fortunate to have him speak with us today. And so I'll turn it over to him, and he'll speak for about 45 minutes or so, I guess. Horacio, más o menos, 45 minutos, and then we'll leave some time for questions. So, adelante, bienvenido, muchísimas gracias.
Y buenos días, Ana, y buenos días a
good morning.
todos.
Good
En
morning,
primer lugar,
everyone.
muchísimas gracias
Well, first,
por
thank you.
invitarme.
Thank you so
por
much for
invitarme.
this invitation.
As Ana said, I will speak in Spanish because I have my slides in Spanish, but I can also take questions in English if you want. So, lo que yo voy a hacer ahora es
What I want to do
tratar de
now
comentarles
is
y
try to
compartir
comment
con ustedes
to all of
lo que
you
nosotros estamos haciendo en el Instituto
what we are
Nacional de
doing
Salud
at
Pública
the
relacionado
National
con la
Health Care
investigación
Institute in Mexico.
en cambio
And this
climático,
is
pero
related
también
with
en
the
otras áreas.
research that we've done
El
in matters
propósito
of climate
de esta
change.
presentación
The main
es
purpose of this
darles a
here
conocer
presentation
a
is
ustedes lo
to
que hemos hecho y lo que
give you
estamos haciendo
the
en el
results
Instituto Nacional de Salud
and
Pública
also
de
talk to you
México
about a little bit
en el área
what we're doing
de
at the
salud
Institute
ambiental
in the
con el
area of
propósito
environmental
de
health
buscar
with the
el mayor
purpose
número
of
de
looking for the
colaboraciones
majority of
e interacciones
collaborations,
posibles
the
con
majority
ustedes.
of
Sabemos
scientific and academic
que el programa, el proyecto
interactions,
donde están
because we do
ustedes
know that the program
tiene
that
una
you are a
importancia
part of
muy
has
grande
a
y es de
a
nuestro
considerable
mayor interés
preponderance, and
buscar
it is
interacciones entre lo que ustedes están
within
haciendo
our
y lo que
interest
hacemos
to look for
nosotros,
interaction.
tanto en términos de
What you're doing is similar
investigación,
to what we're
como en
doing in
términos de
matters of
docencia,
uh,
como en términos de incidencia
teaching,
en
in matters
políticas
of
públicas.
influence in public
No
policy.
se asusten demasiado
And
con
please do not be
outline.
scared or
Voy a
troubled
tratar
by
de
the
que la
outline that I'm going
presentación
to
sea lo
show you.
menos
I'm going to
aburrida posible para
really make an effort
ustedes
to make
y voy a tratar
out of mine a
de
very dynamic
comentarles
and fun
cómo ha sido nuestra
presentation.
experiencia y
I'm
cómo
going to try
estamos
to share with you
organizados
what
acá
our
en el
experience
instituto
has
en
been
el
like
área de
here
salud
at the
ambiental.
Institute of
Yo
Public
coordino
Health
una
and
dirección
Environmental
de
Health.
área en la que
I
participamos
am the
25
coordinator in an area
investigadores
that has
la
25
Dirección de Salud
researchers, is the
Ambiental
direction
del
of
Instituto
environmental
Nacional
health
de Salud
of the
Pública.
National Institute of Public
Tenemos,
Health.
como
And
comentaba
what
Ana,
we have, as
desde que se
Anna
fundó
was
el
telling us,
Instituto Nacional
ever
de Salud
since we
Pública
started
en
the Institute of Public Health
1987,
in
realizando
1987,
investigación
doing
sobre el medio
investigation,
ambiente
doing
y
research
salud en
on
diferentes áreas.
the environment and health, and in different
Nosotros,
areas
como
of
dice acá,
responsibility.
empezamos haciendo
We started this doing research on atmospheric contamination, especially in the city of Mexico, when the city of Mexico was actually one of the most contaminated cities in the world. And so we survived to this, and we were also able to investigate the research on the effects of atmospheric contamination and in other Mexican cities as well as we moved on with our research. We had research on lead, for example, back in the times where lead was still popular in gasolines. It was present in gasoline. And the research that we did at the Institute allowed for the production of new norms regarding the use of gasoline and the refining of gasoline. And they agreed to take the lead out of the gas. And we were working on those first years also on the insecticides and for protection against plagues. We had a lot of work with people in charge of the application of DDT and also other populations. I would say around the year 2000, the agenda for investigation for this institute was a little bit diversified, and we began to do research on other issues. For example, places that were contaminated and in mining sites as well. We began to have experience in places where we would exploit manganese and gold and silver, etc. And in places where we had deposits for toxic waste in the city of Mexico. And then we started doing interesting research on other contaminants, such as persistent substances like oxalates and others. And we also developed a great guideline for investigation on contamination and interwall contamination. I'm talking about the exposure to smoke that comes from burning logs. That, as you know, is very popular. You got to know that we use a lot of that. 27 million people here in Mexico are still exposed to that smoke, log burning smoke, especially in the rural areas of Mexico. And we began to do a research on climate change and health around the year 2003. And the first studies that we had were about the climate variability and the incidence of dengue and other Mexican states. I was just commenting, Anna, that this is precisely where we learned how to establish a dialogue with the people that we know as climatologists in order to understand the different variables that could be occurring in the variation of production of different results in health, in field, and in the cities. And I'm going to start sharing some examples now. On almost out of a necessity, we had to start developing another guideline for investigation in policies and environmental research policies that implied for us to start linking ourselves with the decision makers worldwide. And in order for us to modify the norms and in order for us to modify the standards, especially regarding the quality in the air, and have a research that we do here at the Institute would actually serve to allow for this decision-making process in the regulation of the official norms of environmental health. Now, from the point of view of development of environmental health at this institute, obviously we have been modifying this because basically what has happened is in matters of environmental health, it has been turning into sort of a transversal issue for the entirety of the institute. We used to be, let's say, the only ones who would do research of this sort. But after the creation of a guideline of investigation for all the institute, the issue of environmental health became sort of a transversal matter, multidisciplinary, and involving collaboration among different researchers in the 7 centers of research that our center has. After this, and for about a period of time of 2 years, we created at the National Institute of Public Health what we know as the Special Planetary Health Program. The constitution, the conception, the creation of this program has allowed for much broader collaboration for researchers in public health from other centers, for example, in health care services for infectious diseases or vector transmitted diseases, a lot of collaboration in matters of nutrition, for example, and a lot of collaboration with other centers that dedicate that devote their time to investigation as well. What we have at the Institute now is this transversal program that is under the, say, umbrella of the planetary health concept that has been widely disseminated in our institute. We have also developed the research groups and teaching groups. And for the outside, I mean, nationwide, we have grown a lot with the Constitution, with the development of what we know as a network for evaluation in endemic scenarios, which is a multi-institutional network of researchers and students. We're working in different universities and different centers for research in the country, and this has opened a collaboration in matters of public health among its different components. We are comprised in research groups and teaching groups, as we call them. This is our teaching and a research group oriented towards quality of the air and climate change and human health. So what we've done is to group all of the researchers of our centers and of other centers in this research group, and it has also served us to incorporate in a much more active manner the students, and I'm talking in postgraduate students, master's program students, to make them a part of the School of Public Health, and also for universities to reach for universities and schools abroad. We decided to create this research group that, besides in a joint manner when it comes to climate change, they work on quality of the air, because we have been seeing in the cities, these issues are way more linked than you would think, and this has allowed us to develop research groups that are joined in nature in these two issues. We have a group of research in chemical substances and contaminated places. It used to be just for mining sites, but we have decided to expand it. And now we have this research group and teaching group in chemical substances. And our objective, of course, is to do research on the effect of chemical substances and places that have been damaged by human contamination. We're very interested in exposures to mixes of contaminants, and also take new approaches like exposomas, which is the one that we're working with right now currently. We have another group that dedicates to research in contamination. It just used to be a group dedicated to contamination of the water, but because of climate change, I would say that the shortage has become quite relevant in terms of public health for our country, especially in a region like the ones that we have in the north and the northeast. This research group and teaching group in water has expanded. They've grown a lot because in other groups that also work the matters of nutrition have become quite interested in healthcare effects derived from scarcity of water. The lack of water, this group has grown a lot in the last years. We have a final group oriented towards researching the effects of the environment in child development. This group had the participation of some researchers that for a long time They've been they've had they have been following some cases in the city of Mexico, the from certain communities, certain neighbors in Mexico. These people that they've been following ever since they were children are now adults, and that this has allowed for the investigation of a number of environmental factors and the development of ailments and diseases, metabolic diseases in the children. And this is obviously a group that is very, very productive. And the other one is a group that is called Environment, Nutrition, and Chronic Diseases. Here we have a close relation with air contaminants in the food and its effect in the development of diseases, for example, cancer or others. This group is led by a Dr. Lisbeth Lopez Carrillo, an extraordinary epidemiologist that has many years doing research on environmental contaminants and risk for prostate cancer and other forms of cancer in the city of Mexico. So, as I said, we also have this special planetary health program and also for the transversal approach to accomplish a more transversal approach at the Institute, issues related with environmental health. We have been incorporating very, very progressively to all the academic programs outside of the concentration area. So whoever studies a master's program and diseases transmitted by vectors or by nutrition or by health systems, all of them should have a content type related with environmental health. So when we restructure the academic programs, the inclusion of the environmental issue has become quite important. We have collaboration with other research groups, other centers and directions. We're working quite strongly with Urbal Health, but we also collaborate in other studies. For example, Des Maestras, a teacher in feminine in Spanish. We are talking about 15,000 teachers. They have been followed for many years, and we are studying and incorporating factor analysis for environmental risks in women in the development of chronic diseases in this particular sample. And we also have collaboration of other researchers, for example, residual or waste waters. When it comes to epidemiological health with residual waters, we work with the environment and vectors with the Center for Research in Infectious Diseases. And we have intensified our collaboration a lot with the researchers that do work on the different agro productive systems and their impact in health. We work quite closely with Dr. Juan Rivera, as well as with other groups that within the Institute work with the approach of One Health, Una Salud, especially the ones that work antimicrobial resistance. And with them, we develop research projects, but also the strengthening of the policies that belong, our country policies when it comes to resilience, antimicrobial resilience. These are some examples of how the environment has become transversal in our agenda at the Institute. I'm not going to talk about it in detail, but this is a good overview of how we operate. This program has 5 axes: one of research, university extension, teaching, promotion of health, and a design and evaluation of public policy. As you can see on the right, we have been working a lot in public policy, in agro-productive systems, and quality of the air. And currently, as I'm going to mention, we are working in the upgrade and update of policies regarding climate change. We also want the Institute to become an example in environmental management, which is why we also have a program that is called EcoWins, which is the program for the institute that has to deal with energy savings and other aspects within the institute. As I previously mentioned, we are as part of this network of studies, the planetary health in endemic scenes. This is a very important network that wants to provide an answer to environmental crisis and its expression in Mexico. Because we understand that programs regarding environmental health are deeply related, and they're heavily related with the social determinant factors that provide value to them. And so, what we're doing is basically collaboration in specific issues. And for this, we have become a network that has five nodules: a nodule for climate crisis, for atmospheric crisis, a nodule for agro productive systems, feeding systems, one for chemical mixtures, another for hydric water crisis, and another one that we call integrated health, complete and full integrated health. So this network has had, especially, particularly in the last years, a lot of activity because we have been able to generate publications where we express our concerns and the definition of what we understand as planetary health within the world climate crisis, the world environmental crisis. We presented, we issued an article, we published an article called The Environmental Health from the Countries of Latin America, which is a decolonizing view for this concept. And we basically try to incorporate a view of planetary health as part of our problems and also as part of our relations, unequal, uneven relation with the countries in the north. And so this is obviously an issue that is always under discussion. And besides this, we have had a fair share of webinars and courses and workshops. For example, we had a seminar on public policy and climate change and health in the city of Mexico. And out of this, we had a very important positioning of what we believe should be modified in terms of climate change and health. This position, obviously, we passed it to the Secretary of the Environment and the Secretary of Health, and it has helped us a lot because with the change of government, we are under a very close degree of collaboration with the Secretary of the Environment and the Secretary of Health, and we're basically trying to get the issues of climate change and environmental health to be incorporated as part of the national programs of health. And so, we have had other forms of webinars that are quite important. For example, hydric crisis, that one was very important. And with this one, we're working with other organizations as well as with the Senate of the Republic to create a proper surveillance system of the quality of the water, something that works worldwide. I'm just talking about some examples where we are trying to generate a proper positioning as part of public policies and as part of a collaboration within this network. We also had in the summer a first course of planetary health. That was a sort of a pilot course, and it was very successful. And now in this summer, we're going to have a second course of planetary health. And for this, we're going to be making the promotion very, very soon. I also wanted to mention that our promotion center is a collaborative center of the Pan American Organization of Health, and we have been working with them since 1997. This collaboration with the World Health Organization has been quite fruitful. For example, in the beginning, this collaboration allowed us to have the first points of construction for the specialization program in environmental health here at the Institute. Since then, actually, we have recertified as a collaborating center, and now these four aspects make it a part of our working plan for 3 years. Now, as part of this working plan for 3 years, I wanted to comment with a very special insistence what we are doing when it comes to air quality alongside the OPS. We have a sort of built and a Latin American network of experts in air quality and health. And we have done this via the dissemination of knowledge, basically the training in the usage of the tool that we have for the evaluation of impact and contamination of air, which is RQ Plus. And it has allowed us to consolidate this network to a very, very strong degree. What has happened is in many cities in Latin America, they have developed an impact in health for exposition to atmospheric contaminants, and they are trying to incorporate it in its management policies for air quality. In the next conference for quality of the air, we are going to celebrate a conference on the 25th of March this month. We're going to present and we're going to build an action plan for 2030. And we basically congregate with decision makers and we become a part of the technical secretary of this group. What does it mean that we surveil the quality of the reports and of the evaluations and of the courses that we developed in the countries? And so we've had a last year and a half actually quite intense for this network. And I hope that with the conference, we hope we launch this network. And we're going to launch an IQ Plus. And we are going to design a course, which is actually going to be a part of the training platform for the Pan American Organization of Health. Now, regarding investigation on climate change, let me tell you that, as I said in the beginning, we are starting with this type of investigation on climate change and vectors. These studies that we did first in the coast of the Gulf of Mexico. That's how we call it, the Gulf of Mexico, by the way. And we were studying in the coast of Veracruz the impact of the climate variability of the incidence of dengue. And we repeat these studies in other states of Mexico. And then we were collaborating with studies on a global level to be able to estimate the amount of mortality associated with climate change. And so here we were able to produce some, I would say, of the first estimations for the association between the increase of the temperature and the level of mortality in Mexican cities. With this multi-centric level of studies, mainly coordinated with Dr. Gasparini. We have published this about 5 years ago, and that's where we were able to link up with the work that they do right now in urban health, which are studies that are very similar to it. And that's what I wanted to mention, that we had a sort of the development of this guideline on climate change and mortality in Mexican cities, which is pretty much what we are seeing here. And here is where the researcher, the leader researcher is Magali or Taro. She's participating in urban health and in other consortiums around this matter. We're working on climate change, child health, and contamination, atmospheric contamination. We are watching the impact on climate change, on the production of food, but also in the consumption of ultra heavily processed foods. There's a publication there that I wanted to share on that. And also, And also, we have published other forms of articles related with the potential effects of climate change on the health of Mexican children, which is the article that I'm posting on the screen right now in the middle. What we did is put in the center the health of the kids and to having a look at the vector load and how this could be modified, how this could change and mutate in mid to long term. And so we have a very special interest in the study of climate change in the new generations as part of our priorities of climate change. I wanted to comment on some projects, research projects that we have marched on the way. I mean, not necessarily for this month. We are publishing the first project by Wellcome Trust, and it's something that we're developing in Chiapas. And this is one of the hottest locations in the country. And I'm not talking tourism, I'm talking heat. And we are developing a very serious project there for some intervention measurements in order to diminish risk on climate change and health. And this is what we are developing an early alert system that is going to be handled by the very communities in order for us to diminish the risks to health. Now, this here project is becoming a part of a number of projects for Wellcome Trust, and this is heavily financed by the evaluation of intervention in different countries. And so we're doing interventions that have to do with the trees, with green areas, with the modification of structures, little roofs, and white and green. And we are quite immersed in this collaboration as part of the Wellcome Trust that has to do with intervention to diminish the risks. We have also determined a project of 5 years with contamination of the air in the Mexican population. This is a study that was financed by the CONACYT, and we were actually working in 4 of the 5 greatest cities: Ciudad de Mexico, Mexico City, Monterrey, Guadalajara, and Toluca. And we were doing measurements of black carbon and other contaminants, climate contaminants, and other short life. And obviously we have a component that is related with a teacher's cord to measure for impact and measurements and climate and development of diseases, chronic diseases. Something that I wanted to mention as something that lingered from this project is we had collaborative groups. These collaborative groups in these cities where we have investigators, researchers participating, new authorities, municipal authorities and authorities for the development of policies regarding with the mitigation of climate change and also the contamination, the atmospheric contamination. We're working very close with the Autonomous University of Mexico, and we have made a lot of work, review level work with them on the situation of climate change in Mexico. And regularly, as I'm going to show close in short, when we do the diagnosis for climate change and health, what we do is we collaborate with the chapters of human health, other projects. We do a project in Mexicali, but this is another project that just finished. We are also part of other projects that are part of the Wellcome Trust that has to do with other potentials on food safety in Mexico, especially oriented toward the consumption and distribution of corn and beans. But also there is a very important component of evaluation of risks in agricultural workers. This is a project that we're coordinating as a something that we're barely getting started with this year, and it's going to last 4 years. And we believe that it's going to be quite interesting in terms of collaboration. And we're also collaborating in a project of the World Health Organization for the development of an ethical framework for the development of research in climate change and health. This ethical part on research and health is an issue that has carries a lot of interest for us. We're also working on it with groups, welcoming groups. And this is a little bit of a summary of what we're doing in climate change and what we're doing in cities and other populations. And this is what we're doing in Chiapas, in the coast. And these are the communities that we're working with, besides doing it with local institutions such as the Secretary of Health, the Mexican Institute of Social Health, and in a very, very important manner with the schools and the teachers. So this is a project that has a lot of social participation, but it carries another part of evaluation of impact for this project, and we're developing a component of renal markers, for your kidneys to measure acute damage, just to see if we have good levels, if we can get good levels there for our measurements. Different components of this is the project that I just talked about in the city of Mexico. And I want to continue with this project to the last call that we had for welcome, and we want to present this proposition for evaluation of impact to the adaptation projects in the city of Monterrey. This is how we want to provide continuity for this project. And this is the program that we have for the master's degree in matters of health. We also have this as part of the area of public health, as well as the science area. And in the doctor's degree program, we have a workshop on new knowledge on dengue. And this is how we participate in the issues of climate change and with the course of planetary health that I just mentioned. We also developed a training course on climate change and health, and it was available for many years at the platform of the OPS. We had about 5,000 students from the region of Latin America that learned basic concepts on climate change and its relation with different problems, acute and chronic problems in nature regarding health. At the level of public policy, to wrap up a little bit, we have collaborated in the adaptability programs in different states, especially in Veracruz, in the city of Mexico, in Morelos, and New Leon. These state plans obviously have to be updated periodically, and then we have collaborated a lot in the issue of health, and we have also participated in the communication and national communications in the framework of the Convention for the United Nations on Climate Change. Here we have two examples for national communications that included a chapter on health, and this was the one that we collaborated with. We were also working with the Economic Commission for Latin America, the CEPAL, and this is where we generated these two publications that have to do with the development of a methodology for the development of adaptation programs to climate change and the health sector. This here is a brief example. I'm not going to talk about it in detail, but this is a methodological guide, and some countries actually utilize this for the development of their national programs and policies for adaptation to climate change in the health sector. The last year, actually, we were working at the request of the Secretary of the Environment in-depth analysis on the incorporation of solutions of climate action that were actually based in nature. We had a review in our country of the literature, of the policies, and of some interviews, basically to conclude that in terms of public policy, there's still very little what is being done in Mexico to incorporate solutions of climate change that are used and based in nature. And it's something that we're reviewing.
Hemos estado en otras redes, como una red
We have done this in our network of the PENUMA
Medio Ambiente y Salud.
As part of
Y
environment and health.
Ya para, ahora sí ya voy a terminar. Estas son algunas colaboraciones
These are
en
some
grupos de trabajo
collaborations
que tenemos
in
las
working
ciudades
groups
de
that we have
Valle de México,
in the cities of
Monterrey y
the
Guadalajara.
Mexico
Nosotros
and
básicamente
Guadalajara.
estamos en el grupo núcleo de los programas de gestión de
We
calidad
are
del aire
in
en
the
estas tres ciudades y es lo que
air
nos
quality
permite hacer
management group,
propuestas, ¿no?
and this
de
is what allows
políticas,
us to do
de
or
políticas
present,
públicas.
submit
En
propositions when it
específico,
comes
en
to
la Ciudad
public
de
policy.
México, llevamos varios años trabajando en el
And we have been
desarrollo de un
working for many
sistema de
years
vigilancia de calidad del aire
in
y
a
salud
surveillance system
que ya
for
está a
quality
punto
of health.
de echarse a
And
andar, que
actually, we're
vincula la
about to
parte
develop
de los
this.
contaminantes
And it's a
atmosféricos
part of the
con
atmospheric
el registro de
contaminants
eventos en
with
salud
the register
en
of events
hospitales
regarding
y
health
clínicas.
and
Y este
some
tema de
hospitals
vigilancia y
and
salud
clinics.
ambiental
This issue
creemos
of
que es una
environmental
cosa
health,
que se va a
ladies and
ampliar
gentlemen, we do believe that
hacia
is something
otras
that is going
áreas
to be
que no son
expanded
calidad del
to
aire y
other
por eso
areas that are
estamos
not
trabajando
quality of the
ahora
air.
con la Dirección
And
General
that is why we're
de
working with the
Epidemiología
General
de la
Direction
Secretaría de
of
Salud.
Epidemiology and the Secretary of Health.
Este es el último reporte en el que
This is
trabajamos,
the
que
last
es el
report
reporte de cambio climático en
that we
México
work on in climate change.
2023,
This
que
is a
está
report for
disponible en
2023.
línea, que realizamos en colaboración y
And
bajo la
this is what we do with the
coordinación
collaboration
del
and
Instituto
coordination
de
of the
Ciencias de la
Institute
Atmósfera y Cambio Climático de
of
la UNAM.
Atmospheric
Aquí pueden
Sciences of
encontrar
La UNA.
el estado
This
del
is
cambio
where we can
climático
find a
en
state
México 2023
for
y
climate change
actualmente
in
estamos
Mexico
trabajando con
2023.
ellos para actualizar la
And we're
contribución
working with them to
determinada a
update
nivel nacional
the
para
contribution determined
2030, donde acaban
nationwide
de invitar
for
a un proyecto
2030. They
en
just
donde van a
invited us to a
elaborar
project
la
where we are
CND
going
para
to
México
elaborate a
y
CMV
que
from
va a tener
Mexico, and it is
una
going to have an
prospección
extraordinary
hasta el
prospection
2030.
up
Entonces,
to
aquí en este proyecto
2030.
estamos trabajando
So
muy de
this
cerca
project, we're working
con la
very,
Secretaría del
very
Medio
closely
Ambiente y
with the
con el
Secretary of the
programa
Environment
de
and
investigación en cambio
with the
climático de la
investigation
Universidad
program on climate
Nacional.
change from the National University.
También estamos en la Comisión
We're also part
Intersecretarial
of
de
the
Cambio Climático,
Intersectorial
que es
Commission of Climate
la
Change,
máxima
which
autoridad de
is
coordinación
the
en cambio
top
climático en
authority in
México.
coordination of climate change in
Ahí la
Mexico.
Secretaría de Salud
Also,
tiene
the
un lugar
Secretary of Health
y
has a
nosotros
place here,
participamos como
and we
parte de la
participate with them
Secretaría de
as
Salud
part
de
of the
México en
Secretary
esta
of Health
comisión.
in this commission.
También hemos colaborado en
We have also
el
collaborated
Countdown
in
sobre
the
cambio climático
onset
para América
countdown on
Latina.
climate change
Ahí
for Latin
Magali tiene
America.
una
Here,
colaboración
Magali has some
importante.
collaboration I believe is very
Y
important.
también
And
estamos
we have
en
also
la Asociación
become a part
Internacional de
of
Institutos
the
Nacionales de
International
Salud
Association of
Pública.
National Institutes of Public Health.
Hacemos parte de dos
We
grupos
are
de
a part
trabajo,
of
uno de
two
cambio
working groups,
climático y
one
otro
related with
de
climate
salud
change and the
planetaria.
other related with
La
planetary
Asociación
health.
Internacional de
The
Institutos
International
Nacionales de Salud
Association
Pública
of National
tiene
Institutes of
cierta
Public Health
incidencia
has a
en
certain level of
organismos
incidence in
internacionales como la
international organisms
OCDE y
such
otros,
as the
y es
OECD,
un
and
organismo que es
it's an
escuchado para el
organism that
desarrollo
is always
de
revered
políticas, en
when it
este
comes
caso
to
de
the
cambio
development of
climático
policies
y salud, y es
for
algo en lo
climate
que
change
estamos
and
también
health.
colaborando.
And this is something
Finalmente,
that we're collaborating in as well.
organizamos este evento que
We also
fue
co-organize this event
el Congreso de Investigación en Cambio
with a
Climático y
Congress
Salud
of
para América
Investigation
Latina, que fue un
for
evento que
Latin
se hizo
America,
a
which
finales
is
del año
uh,
pasado.
an event that we
Y
did
como
last
resultado
year.
de ese evento,
And as a result
actualmente
of
se está
that event,
construyendo
we are
con
developing
institutos nacionales de salud de otros
with the
países
National
una
Institutes
red
of Health,
latinoamericana de investigadores en cambio
a
climático
network
y salud,
of
que
climate
eso está
change,
todavía en
which
formación.
is also on the
Y
way
ya para
to be
terminar, pues,
reported.
y como
And to
propuestas
wrap
que
up,
podemos
because I know we have
discutir
a block of
con
questions
ustedes,
until
estamos muy interesados
1
en
p.m.
seguir participando en el
Until
proyecto de
I'm sorry, I mean we
Salurbal,
have 10 minutes. I'm
especialmente
participating
con
in
estudiantes
Saludable
de
project
nuestra Escuela de
with
Salud
students
Pública
of our public health care health schools and with other students. We're basically trying to build a network of experts from different cities in Latin America, and we're very much interested in participating in the development of scientific articles. This is something that we are heavily invested in. We're practicing this with Anna, for example. And we would love to link this with other networks of experts in Latin America. I believe this is an extraordinary proposition that we could discuss and also establish links and connections with this network of studies in planetary health, and also to have events and collaborations, joint events and collaborations. And finally, we have at our disposition to link this project with local authorities, with other local authorities that are trying to update the policies in environmental health in Mexico as well. I do believe that in this administration, this exchange has been strengthened, and I consider that the results for projects like the one we have here for urban health can be extremely important in order for us to enrich and evaluate public policies in these issues. This is all I have, ladies and gentlemen. I don't know if I spoke too much or too fast, but I am here to absolve any doubt. Please, I believe we're going to begin the Q&A now. Thank you.
Gracias, Horacio. Thank you very much.
Thank you very much, Horacio, for this
overview of all the great work that's going on.
overview.
We'll definitely follow up on the SALURBAL suggestions. But we can take questions or comments. Please raise your hand in the chat or here. Maybe I'll start out with the one question. I was wondering if you, based on all the experience you have, if you have any examples you can share of a situation where you think the work that you did or that your team did had a significant policy impact, something that worked, where you could see pretty directly how something that you contributed to influenced policy, or a situation where that didn't happen, where you expected it to happen, but it didn't work. So things that worked or things that didn't work. Are there any examples you could share? That would be, I think, very interesting to this group.
Oh, yeah, sure. I think that I have more examples for the second one than for the first one. But anyway, yeah, we have had a very important influence on the policies on air quality in Mexico. We have influenced the regulation on air quality and health in Mexico, I would say, especially since 2014, in which we have been working in the working groups that produce the new regulations. We have used all the information that come from our research work, because we have done a lot of research on acute and chronic effects of air pollution, and besides that, fortunately I participate in the group of the WHO new guidelines, so I bring it to Mexico also, and from there we actually did a very good work in the updating of the regulation in Mexico, and that has had impact because, for example, from the national regulation, we developed also the national index on air pollution and health, which is the main tool to communicate the risks to the population. And now this regulation, this norm, has to be developed in all the cities that have monitoring networks. So clearly, this is an influence, and we always think that we could have a kind of domino effect where you influence the regulation on health, and they have to take into account in other regulation policies. For example, the emission regulation or others. So for me, this example is very good. Is now ongoing influence. For example, just today we had a workshop where participate all the state authorities of environment and health, and we explain again what is the role of the quality air and health index, because they need to apply this in all of the cities of Mexico. So this is something that is going on right now, and have a very hard influence on all these state and national policies. We have so many other examples of what didn't work. For example, we are working now in all the new regulation on lead for Mexico, because we want to have two things: a new regulation on blood lead in children. We are pushing for that, and we would like to have also a surveillance system on lead toxicity, and that's something that we are now negotiating with the authorities. Some other examples have not worked as well as we want. For example, we are pushing for a new regulation and policy on chemical substance for Mexico. We make a first step in the previous administration, but we want to have an integrative regulation on the use and manage of chemical substance in Mexico. So this is something that have not finished, and well, there would be many other examples. For example, in mining sites, we have also many experiences, some good and some bad.
When it hasn't worked, has it been mostly just lack of political will, or is it because you weren't able to generate the kind of evidence that would be convincing?
We have the evidence, but it's hard to convince the industry, in this case, the mining industry, to make some other processes going. It's very difficult. There are many interests there. So when you have to do with the private sector, this is a little harder.
I see Mariana has a follow-up question. Mariana, do you want to say your question? And then I see we have someone else.
Yes, thank you. Anna, can you see me? Yeah. Hi, Horacio, great to see you. It's been a long time. Great work. And just to follow up on what Anna asked about the specific examples of things in which it was successful, and great to hear the impact of your work for the air pollution standards. Was there a particular set of studies or a piece of evidence that you feel was really fundamental to influence those standards? In thinking about, what is the evidence that really makes a shift, like we need to change these policies, and we need to set these standards.
Yeah, there are some stories on that. For example, in this field of air pollution, we have many discussions on if the evidence is from Mexico or from outside. So many decision makers need to have local evidence. And even when we say if this happened in China and Europe, it happened here in Mexico, but they say no, maybe we are more resistant or not. So it has been very, very useful to have local evidence, and I think that's important. The other thing that I think that worked very well is to include in all this discussion the issue on human rights, the right to healthy environments, and that has been linked with the evidence. And this combination works very well. We are not using scientific evidence, but also we are incorporating some other scopes like the human rights and the right to healthy environment, and that has been very important in all this discussion. I have some other examples, but in this moment I can't remember that.
Thank you.
In the Q&A, we have a question.
Yeah, well, someone's raising their hand. Is that,
Yeah.
I don't know which was first.
This was first.
Yeah.
Yeah, I can read it.
Okay.
Así de Herrera pregunta, bueno, dice, gracias, doctor Horacio. Me gustaría saber si ha trabajado en estrategias de resiliencia.
Thank you, Dr. Horacio. I would like to know if you have worked in resilience strategies for climate change. That is a question.
Starting on that, we have a group in our network that is working in the hospitals and medical units, especially in the Mexican Institute of Social Security. They are start working in the hospital, trying to work in mitigation and adaptation to climate change. They already have a study on the impact of the hospitals into the environment, and they are trying to modify some policies in terms of the use of some kind of materials and some kinds of waste management and all this. So this is something that is just beginning here in Mexico. Mexico, I would say from 2 years ago. And we have a colleague there in the Mexican Institute of Social Security that would be very interested in this issue. And they are now already working in some hospitals on this.
Thank you. I think we have time for one more question. Yes, so online, I don't know, Eugenia, LG, I'm not sure how to pronounce.
Yeah, it's fine. Hi, Ana.
Hi.
Hola, Horacio.
Hola.
Qué gusto volver a verte.
Hi,
I can do it
Horacio.
in English if you want. So I'm wondering about access to hospital records and data on health, publicly accessible data, and if you haven't encountered some issues with that, because I feel like in Mexico and other Latin American countries, we don't have the same level of access that other high-income countries have to those type of records. So it's a little bit more difficult to actually match, hospital records or like the health information to pollution, contaminants, and the effects of, for example, the industry at a granular level. So I would love to hear your thoughts on that. And I know we're on time, so it can be a brief reply.
Yeah.
Thank you.
Yeah, briefly, we have very good data on mortality, as maybe you know. We have almost no problem with that at municipality level. We have problems with the morbidity data from hospitals and from clinics. We are trying to fix that. Now we are working in here at our institute in a unit of epidemiological intelligence, we call that way. And now we are working with the direction of the General Direction of Epidemiology in the Ministry of Health. We are now working, for example, in Mexico City with daily data from the hospitals and the clinics. And we are trying to use some kind of electronic registers for that. The electronic registers is something that it is growing and growing more in Mexico. Not all the states have that. We are trying to use that in Mexico City and some other cities. And I think that's something that will work from now on. So yeah, we can share some experience with the morbidity data, but yes, we have a lot of challenges in the past.
Thank you. Thank you so much. Thank you, Horacio, for sharing this time with us. It was great to hear about all the work, and we look forward to more collaborations in the future. So thank you. Thank you so much. And thank you to everyone for joining today.
Thank you. Thank you. Gracias. Hasta luego.